So trying to push the cryoprobe, we can see the cryoprobe inside the lymph node very clearly. We can see the tip advancing. Here we can just move in and out to see where is the tip here, and to confirm we can just rotate right and left, and once the tip is located, hold the cryoprobe 1, 2, 3 seconds. This is another sample. Okay, slides.
Yeah, hi, I'm Rohit Narayanan from Dhatri Life Care Services. We are the authorized distributor for VIVA, the confocal fluorescence microscopy for this region. A quick brief about the equipment. This is the VIVA 2500. What we are able to do is we are able to get H&E like images in less than 5 minutes. And the beauty of the entire process is that even after scanning, the tissue integrity is maintained, which means that we are able to take the tissue sample for further processing as per whether it is IHC, NBS or whatever it is. Now I will start the processing of the sample. We have the sample which has been taken on on a matrix which is called as which is a patented charged iron mesh called cytomatrix. All the small samples are taken on this, and we start the staining procedure. We first wash it with a normal saline to remove any blood or anything that is there. Then we alcohol. We fix this tissue by using ethanol 70% for 10 seconds. Then we stain using acridine orange for 30 seconds. Now we will stain it with fast green for 20 seconds. Now we will repeat the process once more with 10 seconds of for ethanol. Next, the same process of 30 seconds of acridine orange.
From left hand you can do, sir. Yeah.
Next we do 20 seconds for fast green. Now we will rinse the sample with normal saline just to wash off any excess stain that is there. Now we load this mesh on onto the glass slide with two strong magnets. We will put couple of drops of normal saline. We will put a drop of normal saline on the other slide just to ensure that there are no air bubbles coming in. And here the slide is ready to go onto the scanner. We'll just blot off any excess stain that is there.
Sir, just show it.
So the tissue that we are going to image is on the underside, as the objective of this microscope is on the underside. We place the sample onto the microscope.
Don't close it, sir.
We'll add some ultrasound gel on the objective for better coupling. And for all of your benefit, we will now start scanning. I will not close it, but in an ideal scenario this could be closed, but for you to see how the magic happens, I'll leave the door open. We'll say click picture here, and then you can see the stage moving. So now so now we will be setting the stage to 0. So we'll try so here you see the first image coming in. Now this is where we will set it to 0. Now we'll identify the plane where we can see the best. So this is the image that you are seeing is not even scanned as of now. So this is that quick. So we can go probably a little deeper. Just checking on another location. So this seems to be the best. So what we could do is we'll select the area to be scanned, and we will scan it now. So the scan has been done, the image is acquired. Now Dr. Shah will take you through the findings.
I am Dr. Milap Shah. I am the Chief Histopathologist of the Yashoda Group of Hospital. Now we will go through how the slide has been made by this VIVA confocal microscope from the sample. Now the beauty of this machine is that we are not cutting, or we haven't used any freezing machine or a microtome to make the slides. The slides entirely be made directly from the sample, and it has been stained with the acridine orange and the fast green. Now if you see that the acridine orange is a nuclear stain, so that it will not stain the RBC, so we don't have any background stain. Now we'll just go through the sample and we'll see what are the abnormalities in this sample. So this is a mediastinal lymph node from the female patient. Now we just go through this area. We are seeing the abnormal cells which are clustered and grouped together, which is a high nucleus ratio, abnormal nuclear chromatin, and the irregular clumping. So these are all tumor cells. So by this image we can make out this is a non-small cell carcinoma. And the second thing, we can also analyze the adequacy of the sample, because downstream we need to use this material for the immunohistochemistry purpose, PDL1 staining and the next generation sequencing. So if you can see this, the entire slide or the entire sample, this from entire area is filled with the tumor cells. So the material is excellent and it is adequate for the further downstream sampling like the next generation sequencing and the PDL1 by the IHC. So the advantage of this machine is that we can cut down the time. Second, we are not losing any sample for the while the cutting or while the freezing. It will not have any freezing artifact and it will not have any RBC artifact. And simultaneously, this is just like the rapid on-site evaluation. We can do it right inside the theater rather than transporting sample from the OT or the bronchoscopy or the EBUS room to the lab. So this is excellent machine and very nice quality images we are getting, and we can give the diagnosis also on these images. The images can be stored and can be used for the archival purpose and the further research purpose also.